As I said, I weave CFT through everything that I do, but there are also other approaches that I use and that are recommended for complex trauma too. So let's take a little look at those. EMDR, you might have heard of that one. It's eye movement desensitization and reprocessing. I would say probably one of the biggest people to talk publicly about having received EMDR is Prince Harry. Of course, he had a very unusual childhood, and he spoke about feelings of disconnection from those that were raising him, especially after his mum, Princess Diana, died in a really tragic way. The next is what's called somatic therapy. This helps to release the stored trauma in the body through movement, breath work, and mindfulness. This might also include things like yoga. That can be really, really helpful, because the ideas of Bessel van der Kolk, in his brilliant book, The Body Holds the Score, talks about, sometimes when our body's in particular positions, it can be really triggering because our body thinks, oh no, it's going to happen again because this is a position I was in when X, Y, Z happened. And so being able to process the traumas whilst in certain positions can be really powerful. Internal family systems, IFS. It's the idea that we carry around younger parts or younger versions of ourselves, or even versions of other people. And last but not least, we have schema therapy. That is working on the deep-seated core beliefs formed in childhood trauma, which helps people to reframe their sense of self.
To watch the whole episode, head to YouTube, where I am Dr. Marianne Trent, or wherever you get your podcasts, search for the Aspiring Psychologist podcast.